You're listening to Health Professional Radio. My name is Wayne Buckler, and today my guest is Dr. Sonya Jessup. She's a fertility specialist and gynecologist at Demeter Fertility, and she's here to talk to us because it's National Fertility Awareness Week, and we're going to talk about her work and some interesting stories and expert commentary about fertility. Dr. Jessup, welcome to the show.
Thank you very much.
Now, you're a experienced fertility specialist, and you've been through IVF yourself. Tell us why Natural Fertility Awareness Week is important.
I feel almost every person or every couple would like to conceive naturally if they possibly could do so. So it's an important thing for all of us to consider. Women are these days having a lot of IVF and different treatment because they're trying to conceive later in life, and people have more medical conditions as well as they get older, so they're all with that. But in terms of natural fertility, if people are aware when they're young what can maximize their fertility as they get older, and then are aware of how fertility works when they do start trying, they can make sure that they conceive as quickly as possible when they want to conceive, and often they don't need to go through IVF and the more advanced treatment.
Do many couples underestimate how long it takes to fall pregnant?
Most people do. The stats that we tend to use are that two people are completely fertile, having sex, usually over a year, 80% of those couples will get pregnant within 1 year and 90% by 18 months. So in general, most people do conceive within a relatively normal frame of time. The problem occurs if people are getting older. At the age of 38, if you want 3 children, you haven't got the luxury of trying for 18 months to conceive naturally. So that's where we run into problems where when we get older. Conversely, however, if you're 26 and you've been trying for over a year with your partner to get pregnant, there probably is something going on that needs to be addressed because young people should get pregnant fairly quickly.
Now I'm well past the age of having to worry about conception, but in my younger days, it was always just something that happened, well, automatically and maybe inconveniently. What are your top tips for conceiving naturally?
My top tips, when couples decide that they actually want to get pregnant, often they'll stop whatever contraception they have been using. The key for me is just understanding when in the month is the fertile time. And it's a basic thing, but many people don't understand where it is, and they spend a lot of money on ovulation detection kits or other bits and pieces, where if they just had a good understanding, they wouldn't need to do all of that. So what I tell my patients is a regular cycle or a normal cycle, which isn't normal for everyone obviously, is 28 days. So from the first day of your period being day 1 to the last day when you get your period, that's the 28-day cycle. Now, the last half of the cycle is always fixed. So for a person in a 28-day cycle, it's 2 weeks or 14 days before they release an egg, and then 14 days till when they get a period. So the last bit is fixed. So if somebody's got, say, a 30-day cycle, not a 28-day cycle, instead of releasing an egg on day 14, they release an egg on day 16. So it's always 2 weeks from when you release an egg to when you get a period. So that's very useful. You can say when you've got a period, I ovulated 2 weeks ago, that's great. But you need to be able to figure out proactively when you're going to release an egg and not be able to work it up retrospectively. So for people with a regular cycle, it's pretty easy to do. It doesn't really matter if your cycle's every 26 days or every 28 days or every 32 days. You can work out if you've got a 32-day cycle, instead of releasing an egg on day 14, as somebody with a 28-day cycle does, you will release an egg 4 days later, which will be day 18. So if you know what day you release an egg, and we know that the egg survives for about 12 hours, then the very best day to have sex to try to get pregnant is the day before you release an egg. So if you use those basic guidelines, somebody with a regular cycle, they can also add into that, and they can look for cervical mucus being watery around about that time. But you can pretty much pinpoint when you should be having sex to get pregnant. So, yeah, if you've got a regular cycle, it's a relatively easy thing to sort out. The problems come in if you don't have a regular cycle. So you have a cycle that's, sometimes shorter, sometimes longer, sometimes 2 months. And that's where it gets complicated.
Now, that's when we've got a healthy couple and things are all, I guess, normal, are there issues that affect fertility in both men and women outside of that kind of normal spectrum?
Obviously there are. So, for example, it's not all about the woman. So the man's sperm count has to be all right. So, in general, we advocate people, lead healthy lifestyles and don't do too much alcohol or anything drug-wise or anything. In Australia, we see a lot of men going to the gym and taking steroids for muscle development. That has a severe impact on sperm. So it's important for anyone who's taking anything like that to proactively stop those medications about 3 months before they want to get pregnant. With regard to women, the other thing is making sure that going forward you've maximised your fertility when you were young. And that includes things like trying not to get STDs, particularly chlamydia, which is well known to block fallopian tubes. If you do know that there's a family history of endometriosis, try to minimise the endometriosis, which often means things like going on the oral contraceptive pill and running the pill together to decrease the amount of bleeds, which are known to flare up endometriosis. A lot of women feel that the pill will decrease their fertility going forward. It won't, and especially with women with endometriosis, it may in fact improve their fertility so that when they stop the pill, they've got a higher chance of conceiving naturally.
You're listening to Health Professional Radio. I'm in conversation with Dr. Sonya Jessup of the Demeter Fertility Clinic, or of Demeter Fertility, I should say, and we're talking about falling pregnant because it's Natural Fertility Awareness Week. Sonya, what about people who are a bit older? Is fertility in your 40s a viable period?
You can still conceive naturally in your 40s. The problem is that if you are an optimist and you try and conceive naturally and you do so, that's the best outcome. But if you were a pessimist and thought, it might take me a while to conceive, if you start trying at 40 and then try naturally and at 41 realize you haven't conceived, your fertility has gone down dramatically between the ages of 40 and 41. So I always say to people, when you are older trying to conceive, do the tests first to make sure that you actually have a realistic chance of conceiving naturally. So do the sperm test, make sure it's more normal. Flush the fallopian tube, make sure that the tubes are open. Even come in for monitoring so that you know that you're having sex at the right time. So you're making the most of every single month, giving yourself the best chances of conceiving naturally. Because it's a shame when I see people who have tried naturally between 40 and 42. By the time they come in to see me, their natural egg count is so low that it's hard to get pregnant even with IVF. So that's the concern. I think if you're trying in your late 30s, you're well advised to see a fertility specialist and make sure that there's nothing obvious that's preventing that natural fertility. Because if you knew that the sperm count was very low or the tubes were blocked, you wouldn't sort of waste that time conceiving naturally. You would go straight to IVF and try and get a baby while it was still possible and fairly easy to do so.
Now, short of IVF, are there natural fertility treatments available?
Yes, there are. And a lot of my patients who maybe they've had a baby and it's saying, look, it's 3 years, like same partner and nothing else seems to have changed, but we haven't got pregnant. Often with those patients, I'll bring them in and flush the fallopian tube, sometimes just with a bubbly water solution and other times with a substance called lepiodol, which is an oily poppy seed iodine-rich substance. And although we know that anything can flush the tubes, whether it's water or oil or whatever, people seem to get pregnant a lot more easily after the lepiodol flush. And it appears that there may be other factors. Maybe it's having an immunological response or doing something differently. The number of patients I have who conceive within a month, either that month or the month after, of flushing the tubes with lepiodol is really quite extraordinary.
It actually sounds like quite a pleasant beauty treatment, doesn't it? Having a flush with poppy seed oil, it sounds like something quite pleasant.
Well, if the tubes are blocked, it can be a little bit uncomfortable, but if they're open, it's not that uncomfortable. What I used to notice was that when we used to do this treatment routinely, 25 years ago, say, it was a common thing that people would come in and say, my mum said I just need to come in and have my tubes flushed and I'd get pregnant. And it was a bit of an old wives' tale in those days, but in fact, we now know that there was something about that poppy seed oil that was doing more than just flushing the tube. And in fact, some of these women's mums were correct. It was, in fact, a fertility treatment that we weren't quite aware of how good it was at the time.
Now, Sonya, one of the questions that I guess couples face when they want to get pregnant is, when do you say, oh, I need professional help? When should people be seeking medical advice?
That differs for different individuals. So for some people I see who are young and they say, look, we'd like to have a baby. It doesn't have to be, at the moment, but if it happens sometime in the next 18 months, that would be great. I say, brilliant. Well, you've got your 18 months, You can either do the test now to check that the sperm's there, or you can just enjoy life and take the 18 months with the guidelines of this is when you're most fertile and how long sperm lasts inside. But if somebody's a bit older, then I don't say to take that long. After about 6 months, I say, if you are not pregnant after 6 months, you need to come back in and we'll really dot the I's and cross the T's and make sure that we're not missing anything. The other thing is that some people who are younger say, look, I really want to get pregnant now. My best friend's pregnant, my sister-in-law is pregnant. This would be the perfect time for me. How do I maximize it? And in that case, I'd also say, well, let's just do the baseline test. Make sure that we're not missing anything. And just with some education about the best times to conceive, often people do conceive and they realize once they've had the discussion, in fact, we were doing the wrong thing. We were trying at the wrong time. And knowing the fertile times when you're likely to conceive doesn't mean you can't have sex at the rest of the month just for fun and have a normal fun life. It just means that you know that you're getting the best chance and making that fertile window, work for you.
Now, do you see people coming in kind of just looking for a personalised assessment and advice about how they should go forward and getting, I guess in my mind, it's about getting all the ducks lined up in a row to maximise your chances of conceiving?
More and more I do so, and it really pleases me that women are being proactive in this approach. So they're coming in, they're saying, look, other friends have this problem or that problem, and my mum's got polycystic ovaries. I just want to know what my fertility might be like going forward. Should I be worried? Do I need to look into it now? Do I have time? And that's a perfect opportunity to go through, do a well woman health check, make sure everything's fine, and give some sensible advice. I usually do an egg timer test, or an anti-Malarian hormone, and say, look, you have quite a lot of eggs left, and everything looks good. You don't seem to have any endometriosis. I would say you've got time. So, at the moment, you're fine. Other times it's quite low, or there are other health issues, or we find other things. And I say, to couples, when you do get pregnant, or if you are going to get married soon, don't leave it too late. This is a situation that I would advise, as soon as it's possible or a good situation for you, get pregnant early. Don't, pay off the house first or do anything else. For you guys, it would be better to have kids earlier rather than later. And for some women, we look at it all and say, there is likely to be an issue. Maybe it would be sensible to freeze some eggs now so that you've got some options later on, given that you're not in a relationship and there's no one on the horizon. Let's be proactive about this.
Dr. Sonya Jessup, fertility specialist and gynaecologist of Demeter Fertility. It's been lovely having a chat with you today. Thank you for making yourself available.
That's right. Thank you very much.
And if you've just joined us on Health Professional Radio, you can catch up with Dr. Sonya Jessup at the website for Demeter Fertility. It's DEMETER, DemeterFertility.com, and you'll be able there to make contact and get all your questions answered and sorted out. If you've just joined us and you've missed the start of the interview, if you've just come in on the tail end, then I have good news. On our website, we have a transcript for you. We also have an audio app on YouTube, SoundCloud and iTunes where you can download and listen to the whole interview again. You've been listening to Health Professional Radio. My name is Wayne Buckler.